Imagine, and just imagine, a lymphoma patient, a lymphoma cancer patient, being saved from the horrors of chemotherapy. A patient who has had a myocardial infarction can have their cardiac muscles developed again. A patient who has had a sports injury, a spinal cord injury during a sports event, is able to stand up back again. All this is the beauty of stem cells. And I welcome you all to the beautiful, magical world of stem cells. I'm Dr. Sahar Khan, Director of R3 Stem Cell Pakistan. R3 Stem Cell is an American hospital by Dr. David Green. We have We have 55 hospitals worldwide. I apologize for the delay. We have 55 hospitals worldwide and has been the global winner for stem cells since the past 5 years. Practicing stem cells in the past 28 years, Dr. Green has one of the biggest names in stem cells. Apart from that, it's a privilege for me to be the director of R3 Stem Cell Pakistan, operating both in Karachi and Islamabad. I am also the senior dentist and esthetician at THB Global Pakistan, which is the Health Bank Global, having offices in Kuwait, Singapore, Dubai, and Karachi. One of my favorite places, the Orofacial Clinic and Badr Commercial ESA Labs Dentistry since 19 years. And above all, I am the CEO of Sahar. Sahar is a company that provides lectures and awareness campaigns on community levels and corporate sector. Just as I introduced, regenerative medicine and stem cells and exosomes is the backbone of regenerative medicine. How many of us over here have had the idea, okay, we can actually regenerate anything in your body that we have lost? This is what R3 believes in: repair, restore, regenerate. R3 stem cell. That means any person that has lost his hair can regenerate their hair again. Or even when we come towards dentistry, anybody who has lost an alveolar bone, a periodontal ligament, the gingiva, even tooth, can get it regenerated again. Now, this is something excellent in my point of view. In decades before, we've had the opportunity of treating dentistry the normal way, where I have a cavity, I get it filled by amalgam in the 1980s, then GIC composite somewhere now. I can restore a tooth, I can do root canals in a tooth, TICA, and we have these porcelain-fused to metal crowns that are now shifted to ZRC crowns. We have implants, but have we ever thought of restoring and regenerating the same tooth? We can, and that is the magic of stem cells. The key properties of stem cells is, as I told you, regenerates any part of the body. There are two basic types of stem cells: human stem cells, which is embryonic, and adult stem cells. Embryonic stem cells have the potency to divide into any kind of cell in the body. That includes your hair, nails, skin, gut, anything. The best part of embryonic stem cells is that it has no boundaries. It's unlimited. Wherever you inject, it will divide and start forming that specific part that you have lost in your body. Yet again, the only issue is ethical issues. Using embryonic stem cells from an embryo is very unethical, so we've actually stopped it. The second is adult stem cells. There are basically 4 types: induced pluripotent stem cells, bone marrow-derived stem cells, adipose tissue-derived stem cells, and umbilical cord-derived stem cells. One of the best ones is induced pluripotent. But the only issue is to generate a single vial of induced pluripotent stem cells. It costs around $800,000 for one vial. Now, since it's not cost effective for the patient, we have to drop the idea of using induced pluripotent. The next option that we have is adipose-derived stem cells. Adipose tissue, as you know, is a fat-derived tissue. Its level of actually dividing into any kind of stem cell is limited. Since adipose tissue, fat cells don't have the tendency. The third, my most favorite that I always use, is umbilical cord-derived stem cells. Just like a baby is growing, once it's born, the umbilical cord stem cells, when injected inside the body, differentiate into any kind of stem cell. Any organ, any part of the skin or your body can be treated with umbilical cord stem cells. And the best part about umbilical cord is that when it is injected inside a body, right? When you're actually injecting anything inside a body, that's a foreign object, right? Your body will have an immune defense mechanism. But with umbilical cord-derived stem cells, it does not have the MHC factor on them. So when they're injected in the body, your body cannot recognize them as a foreign object. So the amount of the injection of this stem cell is quite higher. For example, when I'm treating a patient, I might inject 50 billion exosomes in one vial, right? Since the body cannot recognize it as a foreign object. And the second part is the maximum amount of stem cells that you're inducing in the body or injecting in the body, they would go, differentiate, divide, and then all the dormant cells of the body or the dead cells of the body are actually treated by stem cells. That is why I said a cancer lymphoma patient and a leukemia patient does not have to go through chemotherapy. The horrors of chemotherapy are way away from them. Or a patient who has autistic or has autism can also be treated with stem cells. The sources of stem cells that we have is bone marrow, umbilical cord, dental pulp, and amniotic fluid. Stem cells replace damaged cells, as I said, the dormant cells, and stimulate tissue repair through differentiation and secretion of the growth factors. Components include lipids, nucleic acids. When I'm focusing on the composition, it's because I need you all to know that stem cells and exosomes have RNA in them only, and not the DNA. And why not the DNA? Because once you inject the DNA of one human or animal or a plant inside a body, you're actually playing with the exact genetic mechanism of that human. So only injecting the RNA is the most powerful and easier way to substitute, since you're not going to risk the human body for anything. The next terminology that I want to introduce to all of you for regenerative medicine is limited and unlimited. Before I proceed further, any one of you has an idea of what regenerative medicine is? Anyone? And have you ever gone through this subject before? Unfortunately, in our colleges and in our universities, this is the most controversial, yet the most important topic that is not being taught in our colleges. I will here be, actually explaining you the terminologies, the basics of regenerative medicine. We're still doing certain researches in certain cases, and inshallah, very soon, R3 will be conducting various research courses throughout the country. I'm myself a diploma DABRM, which is a diplomat of American Board of Regenerative Medicine, and currently consider myself as the only dentist in Pakistan being a DABRM. I'm sorry for the voice, since I'm I'm having a sore throat, so I'm trembling again and again. So coming back to the terminology of limited stem cells is the stem cells that I already discussed, which was human-derived adult stem cells. The adult stem cells, again I said, don't have the potency to divide into anything. It's limited, just like adipose tissue, just like induced pluripotent. Umbilical cord does have the tendency, but still it's not as good as embryonic. So the terminology, whenever you hear about limited stem cells, we're referring to adult stem cells. And whenever we hear the terminology unlimited stem cells, we're referring to embryonic stem cells, whose use, again, I would repeat, has been stopped because of ethics. Yet again, in certain cases, like cancers, we're still using it. Now, diseases treated by stem cells is Parkinson's, diabetes, heart failure, spinal cord injury, leukemia, lymphoma, autism, and the list goes on and on. And again, I would repeat, without any medication. The different aspects that we have is cardiology, diabetes, orthopedics, and my most favorite, and my domain, aesthetics and dentistry. We're using stem cells in dentistry to regenerate the dental pulp, for the periodontal tissue regeneration, for bone regeneration in dental implants, and TMJ repair. We're also using stem cells in aesthetics that I'm using, since I'm an esthetician as well, for skin rejuvenation and anti-aging, for hair regeneration, in which you do not have to graft, you don't go for hair grafts. You're basically growing your hair again. And exosome therapy for healing and glow. Now, since in dentistry, none of us has ever heard of the stem cells, right? And so we don't know what kind of stem cells are we using in which aspect. For example, for when you're doing a root canal treatment, you're actually filling the canal area with gutta perca, but you're not filling it with amalgam, right? So everything has its limitations. So goes with the stem cells. If you need to have a root formation, there's another type of stem cell. If you need to have your periodontal ligament formation or regeneration, there's another kind of stem cell. If you need to have your alveolar bone regenerate, there's another kind of stem cell. So I'm going to introduce all of these stem cells to all of you. First of all, we have the dental pulp stem cells. The source is obviously they're found in the pulp chamber of the permanent teeth. In the characteristics, they are highly proliferative, can differentiate into odontoblast-like cells. And the applications is most important is regeneration of the dental pulp complex, nerve and vascular tissue regeneration, and it's used in the pulp capping and root canal revitalization. So imagine instead of a gutta perca, instead of a crown made of porcelain or ZRC, you're able to regenerate your own whole pulp. The necrosed pulp is actually excavated out, and you're actually regenerating it with the help of dental pulp stem cells. Again, dental pulp stem cells are the mesenchymal stem cells. Like characters isolated from the dental pulp, they play a role in the periodontal tissue repair and regeneration. They play an essential role in dentine repair and postnatal tooth homeostasis by differentiating into odontoblasts. Second important thing is DPSCs do not elicit an allogenic immune response. That means when they're injected inside the body, again, like the mesenchymal stem cells, missing the MHC factor in it, you can inject as many as you can for the best results, and the body won't consider or take it as a foreign object. Hence, no, obviously, immunity issues. The second type of stem cells that we have are the periodontal ligament stem cells. The sources, again, is obviously the periodontal ligament tissue surrounding your tooth roots. Applications include regeneration of cementum, periodontal ligament and the alveolar bone, treatment of periodontitis, and improving the tooth stability and support. So in the past, we always knew when the tooth is mobile enough, we won't be able to fix it. But now we have. Now we have the option that without any surgical intervention, you can actually hold that tooth back again with the help of generation of periodontal ligaments, and that is done by the stem cells, which is known as periodontal ligament stem cells. The third type, let's discuss the periodontal ligament stem cells a little bit. They're basically isolated from the periodontal ligament, and they play a role in maintaining the function of the periodontal tissue, regenerating that structure. The third type that we have is the dental follicle progenitor stem cells. The source includes the dental follicle surrounding the developing tooth germ. The applications include regeneration of periodontal tissues and cementum, and it has a potential role in root formation. So you can see the differences each stem cell is doing. Some stem cells actually regenerate the bone, and some stem cells, like the dental follicle, one of my favorite ones, regenerates root formation. DFPCs can be separated from the impacted third molars. Now, this is the source from where we can actually have our stem cells, because obviously a dental follicle isn't available in a permanent tooth dentition, actually, always. So it's the third molars that we extract out. That's where we get our stem cells from. And this is how you actually proceed by injecting it into other parts where you can have your root formation. The extraction of the third molar is obviously harmless to the normal dentition and minimally invasive. That means DPFCs can be easily accessed. I missed on something. Okay. The fourth type, the stem cells from the apical papilla. The source is apical papilla region, mature teeth. Applications include root formation and elongation, and used in regenerative endodontics. Now, this has nothing to do with the alveolar bone regeneration. This is more for your endo. The apical papilla tissue is located at the tip of the growing tooth root. The differentiation of the stem cells from the apical papilla into the odontoblasts and osteoblasts was confirmed in vitro, and the possibility of regeneration into cementum and periodontal ligaments was indicated. And the fifth most important and my favorite type is stem cells from the human exfoliated deciduous teeth that we have been working on since the past 2 years in our labs, because we have easy access to deciduous teeth, and it has wonderful results with, again, MHC factor is missing. There is no immunity issues holding us back, so the more you inject, the more you can work on things easily. Sources collected from naturally shed baby teeth. Advantages including they're easy to obtain, obviously, non-invasive collection. Applications include bone regeneration and pulp regeneration. So as I said again, in cases where we need to regenerate the pulp and bone, this is the easiest access. This is the easiest way obtaining your stem cells from a deciduous teeth, and that's how things go on. Since I have less time, I'll be shifting quick. Okay. Coming back towards the advantages and disadvantages of stem cells that are being used in dentistry is their natural regeneration rather than any artificial replacements. For example, it's not a filling, it's not a crown, it's not an implant. It's your own tooth, it's your own bone, it's your own gum. Basically gingiva. Reduced risk of rejection, minimally invasive collection, and potential for use in both dental and systemic regenerative therapies. The limitations include they're still largely in preclinical or clinical trial phases. Some of them have started, we've started using them, but some of them are still in their clinical trial phases. So application of stem cells in dentistry. In endodontics, we have regeneration of the dentine tissues. For periodontology, we have regeneration of the periodontal ligaments and alveolar bone. In implantology and oral surgery, it's basically the bone augmentation and osseointegration. Oral and maxillofacial repair is the repair of the bone after cyst or a tumor removal. In orthodontics, it's root resorption and bone removal. And then another aspect, which is known as aesthetic dentistry. Gingival tissue anti-aging therapy using exosomes. Now, I have been a biggest advocate of exosomes since the past 2 years for both dentistry and aesthetics. In dentistry, I have my limitations since, again, we are in the trial phases. But for the aesthetics, I have been using them like anything. And the results, I would say 80%, because the rest 20% don't come back to us after they have better results. So it's like almost in fact, having 100% result. For aesthetics, I use it for two purposes. Initially, your skin rejuvenation. You have wrinkles on your face. Instead of going for the artificial Botox and fillers, I get to give you exosomes. They get inside your body, we get it injected inside the skin. The skin starts regenerating. And I'm turning you from a 70-year-old female to at least a 40-year female, and a 41 into a 21, and all naturally. Now, the difference between stem cells and exosomes in regenerative medicine is extremely important, and most of the time the estheticians or the dentists actually doing stem cells don't know the difference themselves. Stem cells release exosomes. All right, so exosome is a non-living material, while the stem cell is a living material. So please never confuse the both. The differences are, obviously, stem cells are living, exosome is non-living. Stem cells contain DNA, yes. Exosomes only contain RNA. So when, as I said earlier, when we're injecting inside the body for facial rejuvenation or hair transplant, the exosome should only have RNA. Take. It can self-replicate. Yes, stem cells can. Exosomes can't. They can differentiate into new cells. Yes, obviously, stem cells can. Exosomes can't. Immune rejection risk. Yes, stem cells can be rejected. Again, I said the ones that do not have the MHC factor in them, which is the umbilical cord, are not rejected. The embryonic ones are not rejected. Induced pluripotent is not rejected, but adipose tissue can be rejected since the body does recognize it as a foreign object. So when you're injecting inside the body, the concentration should be very less, about 1 billion to 2 billion exosomes in one vial. But once I'm working with umbilical cord, I at least go for 30 billion or 50 billion exosomes compared to the adipose tissue. So you can see the ratio, 1 to 30 or 1 to 50, and you can actually have the feeling how best the results could be. The maximum number you inject, the highest rate of regeneration you achieve. The important facts about exosomes is the myths. Exosome therapy is not scientifically proven. Wrong, it is. Results from exosomes are immediate. No, they're never ever immediate. It's about a wait of 12 to 16 weeks before any results can be there. For example, if I'm injecting for a bald scalp for hair regeneration, you have to wait for about the next 4 months before the baby hair is out. Again, when the baby hair has emerged, you have to look at the quality. Either you mix it with the PRP. The PRP should contain biotin for a better quality of the hair shaft, and if you need to have the better quantity of the hair shaft, the exosome quantity should be higher. That I work on is about 30 billion exosomes. The types of exosomes that we get to have are plant, animal, and human-based. I'm not sure, as if in dentistry you guys know, but please open your Instagram, and every other dermatologist in Pakistan or esthetician in Pakistan is doing exosomes. And if you look or ask them, what is an exosome? What is the source of that exosome? What is the concentration of that exosome? Oh, that's written on the vial, 1 or 2 billion. Is that for injecting in the body? Is it for superficial uses? So the only thing that we end up in a reel looking at dermatologists is, this is an exosome, and the rest we don't know. So let's open and, understand the myths, the facts of using an exosome. Just on a lighter note, a few days back I was invited on a morning show, as you know, the ladies would, And the host there, she said, oh, I know exosomes. I said, that's lovely. Dominica, what type of exosomes are you using? She said, oh, I like plant. Plant बहुत अच्छा है, उसके कोई side effects नहीं है. I said, lovely. I'm really happy that you think कि plant का तो कोई side effect ही नहीं होता. But according to me, plant का effect ही नहीं होता है. Right? You know why? To have a side effect, you should have an effect. Exosomes, as again I said, once it enters in your body, it goes to the dormant cells of the body, activates or reactivates them, and this is the procedure how exosomes work. I have hemoglobin. That's the red pigment. I don't have chlorophyll, do I? The green pigment? I respire with lungs. I'm sorry, I'm trembling a lot today, but the procedure with plants, they do photosynthesis. Do I do photosynthesis? No. Can my body recognize the stem cells of a plant when it enters me? Of course not. We're not plants. Our body won't even recognize कि exosome आया भी था. It will all get drained away. So it's obviously impossible for a plant exosome to work in your body. And whoever says that we had best results with plant exosomes, it was because they combined it with the PRP, that was their own plasma and blood. And when it was injected in the body, it was that plasma that played a little bit of role in enhancing or rejuvenating the skin. It was not the plant exosome. The types of plant exosomes that we have, basically, the plant-derived exosomes that we have in Pakistan are the PLNS, known as the plant-derived exosome nanoparticles. They're not exactly the exosome, rather the nanoparticles, and they're made of RNA. So yes, it does not have a side effect since it is made of RNA, and composition and structures we'll leave for now. And the examples of the plant sources are grapefruit, ginger, lemon, broccoli, algae, and different flower-derived exosomes. Now, the only issue again is you are injecting these. And that's highly disappointing to know. Exosomes that are plant-derived are actually ineffective. Secondly, they're only for superficial uses. That means you can only, use them through microneedling. Have you seen a microneedling device before? Anybody? Okay. That's lovely. It's a device having 16 32 needles simultaneously, and you're just stomping them on the face. Okay? And this way, the serum gets dissolved inside the face. You're not supposed to inject them. They're not made for injection. They're made for superficial uses. But I'm so sorry to say, I think nearly 80% of aesthetic clinics and beauty salons are injecting these exosomes. And I don't know what they would be doing with the genetic buildup of the body. Because on a lighter note, let's come to it. Okay. The next most important and most scary is the animal-derived exosomes. Most of the exosomes delivered in Pakistan from Korea are from the SVF kit, which is derived from the salmon fish. Now, the worst part about the animal exosomes is it has DNA. Okay? It has fragments of DNA in it. Yes, it does have benefits of skin rejuvenation and wound healing, but only if it is used superficially and not being injected. The examples of animal-derived exosomes is from the milk, from the plasma, and from the urine of that kettlefish. As far as the fish is concerned, the most important and the best type of exosomes is from the salmon fish, right? Salmon fish, uski bhi ejaculation hoti hai, specific sperms mein se, that has the best effect on skin. Yet again, I repeat, it is only for superficial uses. Please do not inject it in the body. It has DNA. When you're injecting it in the body, you're actually playing with the genetic makeover of your body. A human body DNA cells having the DNA of a salmon fish. Now they're going to divide जैसे stem cells divide होते हैं for working. And once they're dividing, these cells are abnormal cells, having the DNA material of a fish and that of a human. And what is this? What is an abnormal cell called? That's cancer. Okay? Any abnormal cell in the body is a cancerous cell. And you are actually injecting. For example, a person comes to you for baldness, you want to treat his hair fall, and you're ending up giving him cancer. For God's sake, it's not for injecting, it's again only for superficial uses. Okay, as I said, salmon DNA, and the next most important everywhere you can see in aesthetic clinics is PDRN, which is the burnt form of salmon DNA. These are small fragments, they're burnt, and unfortunately, I would say 90% people in Pakistan are injecting it. And that's, I mean, I would declare it as an emergency because people don't know. The doctors themselves don't know the chemistry behind all these exosomes. The patient obviously does not know. And it's more of a fashion. It's on Instagram. We got the exosomes done, and that's it. Exosomes is a very, very beneficial thing for the body, yet again, very harmful simultaneously. Only, it's like, as we said, A.V.M. Aurangzeb Sahab said that Rafale is a very potent aircraft if used in a proper way, remember? So again, I would say exosomes, if they're used properly, you're doing wonders. But if you're doing it improper, you're ending up giving the patient cancer or abnormal cells, which I believe is one of the biggest crimes. On a lighter note, I don't think people would dislike that, but please, it's the truth. Okay, the third important type that we have is human-derived exosomes, again, which is mesenchymal and hematopoietic stem cells. Hematopoietic is induced pluripotent stem cells, and mesenchymal, again, is the umbilical cord stem cells that I described earlier. Now, currently, when people ask me what is the best concentration of stem cells to be used that gives you a better result, is above 20 billion exosomes. For example, a patient comes to you, you're injecting them with 1 billion exosomes. These are Korean exosomes, these are American exosomes. This is how they're actually labeling it. But they're not labeling it with the source. There's nothing as Korean or American. You should know the source, right? Either it's animal, plant, or human. Human bhi hai, to adipose tissue hai. For example, you're getting adipose tissue exosomes, 1 billion, for hair regrowth. Do you think the fat cells have enough tendency to regrow? You can't, right? So skipping that part, you go for the umbilical cord stem cells. Umbilical cord stem cells that you can inject around 25, 30, or 50 billion. Now, the oil that you're injecting for 1 billion exosomes is around 1 or 2 or 3 lakhs in Pakistan. If you want to have the desired results, at least you will be injecting the patient with 10 oils, maybe 20 oils, to achieve the desired result, right? That would make him give you 20, 25 lakhs. But when you're just injecting the body with one oil, having 25, 30, 40, or 50 billion exosomes just one time, again, that's 4 or 5 lakhs. So it's more of, on the earning side more than treating the patient. So this is just a basic knowledge for you to understand what to do, where to do, when to do, and how to do. So treating your dentistry and aesthetics, both with stem cells, is a major, major goal that we have to achieve. We're making different labs in Pakistan. We have one in Pindi. Inshallah, very soon one we shall be opening in Karachi. We already have one lab of R3 in Karachi where I make my own stem cells with the help of my staff. But since I don't consider myself as eligible enough, very soon we're actually trying to inculcate regenerative medicine as a core curriculum part in universities, and for that we need to have proper labs. So to conclude my presentation. Again, I would repeat, MHC factor, always remember, umbilical cord cannot be recognized by the body, so you can inject as many as you can for the best results. Most important part when I'm talking about stem cells is the safety measures. You're always supposed to check the donor from where you're taking your stem cells, either it's umbilical or the adipose tissue. The testing goes through a donor screening questionnaire, a donor medical review, and extensive tissue testing done under the testing standards consistent with the American Association of Tissue Banks. CGMP standards, highest of any agency globally. For what you're supposed to check, the donors are always tested for HIV, hepatitis B, C, HTLV, CMV, which is cytomegalovirus, syphilis, and the donors should always be tested for malaria, TB, and so on. Now, the gold standard for using any kind of exosome, whenever you receive a vial, always check or ask your vendor, what is this derived from? What is the concentration? And number 3, the most important part, is it sterile enough or is it pure enough? And 4th is the temperature. Exosomes are specifically kept at minus 80 degrees Celsius. Anything that comes in a box to you is not exosomes. Okay? Or even anything that is placed below minus 80 or above minus 80, the actual properties have been destroyed and they are not supposed to be injected inside the body. Right? So ladies and gentlemen, I just finished my presentation, basics of regenerative medicine for dentistry and aesthetics. Any other questions you may please ask. I'm really sorry for the trembling. I'm not feeling well today, but thank you so much, Salman sir, for always trusting. Thank you so much for listening so patiently. I'm a woman. I speak a lot. Thank you so much for bearing me. Thank you.